This is going to help you in the event that you have an attack, assess the risk.
There's more data in more places being touched by more people. So every one of those places is a potential weak spot.
Now the question is, how do you use it to improve care and how do you protect it?
Healthcare data security requires focus now. The health law community has a critical role in implementing effective cybersecurity strategies essential to safe healthcare. AHLA and its members are at the center of navigating this critical area, connecting and educating the health law community to take on increasing threats and evolving legal challenges. Ensuring vital healthcare data remains private and secure is a complicated balancing act.
We've built the privacy rules in healthcare so far to do two things, two main goals. One is protect privacy, but at the same time, we want to have a healthcare system that works well. We could do more to protect privacy under the rules, but one of the effects of that would be a healthcare system that doesn't work as well. And ultimately, that's bad for both consumers and industry.
The risk of cyber attacks has increased dramatically.
Hackers are highly motivated. Data is a hot commodity.
2021 set a new record for healthcare data breaches. The Office for Civil Rights says more than 45 million healthcare records were exposed or impermissibly disclosed.
It's alarming.
One of the biggest things I would be focusing on is patient access. That's where the government is doing most of their enforcement in the privacy space.
Third-party compliance management is one area of focus.
Understanding who your vendors are, what data you're actually transmitting out of your system to theirs, and having that inventory up front is going to really help you mitigate risk and manage any kind of response.
Navigating the future of health privacy law requires, among many things, knowledge of regulated and unregulated data, new developments in technology allowing more access, and security issues relating to HIPAA rules.
The first piece of that is understanding that HIPAA is important and applies to lots of people, but doesn't apply to everything. I mean, that's largely, but not entirely driven by the internet, but you have wearables, you have mobile apps. So there's all kinds of data that's now being collected about your health that isn't subject to those HIPAA rules, which means that's non-HIPAA health data, and we have to figure out what that is regulated by. That package is very disruptive, at least on my issues.
An effective cybersecurity strategy begins with data governance.
If you don't know what data you have and where it is and where it's stored and how it's classified, I don't really see how you can really protect it, quite frankly.
Access, accuracy, and reliability must also be ensured, and patients are playing a larger role.
We have the information blocking rule that gives patients more access to their data, but then also you have the rise of digital health. And I think, EHR and the proliferation of technology, there's more stakeholders. And so the whole point of that information blocking and interoperability is to just give people the data that they need in the appropriate format.
Data sharing, processing, and secondary use of personal health information for uses outside of direct healthcare delivery add more complexity.
Research, data analytics, marketing, business operations. For secondary use, a lot of times you see de-identification or anonymization of data. And in those instances, you may need to procure additional rights or to make sure that you can do that under the law.
Health law professionals staying on top of innovations, layers of legislation, and evolving regulatory frameworks are having an impact.
Data is such an asset. In business school, they call it like liquid gold. Your opportunity to use it to impact healthcare for good, I think, is enormous.
It's not easy to comply, and it doesn't happen overnight. It takes resources, it takes executive and business buy-in, and it takes long-term strategy to get there.
So AHLA has been really great in staying on the frontier of cybersecurity, and they help us understand what the risks are to the organization and what we should be looking in the horizon in order to better safeguard our organization.
I think that's a really important role for AHLA with its broad membership.